Well, we want you all to smile because, believe it or not, oral care is not just about keeping your teeth white and achieving that perfect smile. Now, in fact, oral infection has been found to be linked to systemic diseases such as cardiovascular disease, bacterial pneumonia, and diabetes.
In the Philippines, oral diseases continue to be a silent but serious public health problem. This morning, we get it straight from dentist Dr. Arviel Tolentino and Dr. Brent Silangan. Good morning, docs. It's a beautiful day. Thanks for coming.
Good morning.
Thank you so much for joining us, Doc. First of all, a lot of people siguro might be surprised. Dr. Tolentino, I'll start off with you, na may link talaga yung oral health to other systemic diseases sa katawan natin. Why are those linked? And of course, are people surprised in general na linked po sila? Kasi ako, nagulat ako na medyo when we're reading about diabetes, bacterial pneumonia, na may connection pala.
Okay. So let's start sa pag-isip na everything starts with our mouth.
Yeah.
Even the nutrition starts with our mouth. So if we have the bacteria in our mouth, like if we have the gingivitis and periodontitis, there is inflammation, there's swelling, they're bleeding, and then this bacteria can go through our bloodstream, and then as we all know, our blood goes everywhere in our body. Sa lahat ng organs natin, nandiyan yung blood natin. Now, if you have that bacteria in our bloodstream, this bacteria can also go to our organs, like our heart. So if we have that bacteria, we might have like endocarditis, which is there's an infection in the lining of our heart. So we can also have pneumonia if we have the bacteria in our mouth. So those are the things na maaaring maging related sa ating systemic diseases kasi everything starts in our mouth.
And when you talk about oral infection or diseases, is that a cavity or is that completely two separate things?
So a cavity basically it's a hole in our tooth that is left untreated. It's this tiny holes na hindi natin napapansin na it's there na. So if you notice it na butas na siya. So if it's left untreated for a long time, it might lead to an infection, like an abscess, that might have these symptoms like we have fever na, doon na lang natin siya napapansin na we have this cavity na pala, na nag-lead na siya sa infection or abscess. Meron na tayong pus, nalalaman na lang natin siya if namamaga na, So the tooth might need na mag-root canal na tayo. There are several treatment for that. And it might lead na extract natin the ngipin. So it's like that.
Doc Brent, when you talk about oral infection, ano po yung mga early symptoms that people have to start, visiting the dentist, paying attention to ano nangyayari?
Okay. Now, usually, for dental infections or oral infections, hindi natin siya napapansin eh. That's why pag pumunta ka ng dentist, usually the dentist will tell you, you have cavity, large cavities, right? And then patient would usually get shocked. Kasi, di ba, ang laki na pala. So, usually, sensitivity is a common sign. Bleeding for the gums. Okay. And then once it's worse, it will get into the pulp, which is in the nerve, and then it will basically enter the body. And then doon na siya magsaspread.
Right. So it's really important to go see your dentist, right? Once a year.
For cleaning. No, how often should you see the dentist?
Basically, that once a year is yung lumang ano natin.
Outdated ka.
Outdated na.
Sobrang outdated ka mo.
What is it, once a month?
Basically, we recommend it every 6 months or
Have
twice,
you
at
gone to
least
the
twice a
dentist?
year.
Six months ago.
Okay.
But seriously speaking, so bakit updated ngayon yung standard? Because from once a year to around 2.
Yes. If you could see, nag-iba na kasi yung lifestyle natin eh. Diba? We eat more, there's more temptation, there's more sugar. Even our diet right now, it's all processed foods. It's all sugar. Diba? So imagine eating all of those stuff, and then those stuff would get into your mouth, tapos nakababad lang siya doon.
But even if I brush my teeth and floss, normally, is that still
So no, but I have a feeling sa lifestyle mo, baka 3 times a year dapat.
Grabe ka naman. I brush my teeth 3 times a day.
Actually,
kaya.
it could. It could. For those patients who have periodontitis,
Yeah.
no? Yeah. So basically, mas mabilis sila magkaroon ng plaque. And then, so we recommend them to come back to the dentist every 3 to 4 months. So it all depends on the case of the patient.
Right. And then when we talk about flossing, so I've heard there's a water floss now and then your typical traditional floss. What do you guys recommend in terms of just keeping up with oral hygiene every day?
We usually recommend water floss now, no? But if there are cases kasi na the regular floss, if you're not really good in flossing, it's not proper, no? You might irritate the gums. No? If you go too deep or it's too hard when you floss it, no? It might cause irritation, no, to our gums. Kaya very nauso yung water floss kasi it's gentle, no? But it works the same naman. If you're just doing it properly, no, so it works the same.
Yeah.
To invest
It's
in a
the
water
technique
floss.
actually, na the procedure, the technique is the important thing.
Well, Doc, Dr. Tolentino, now that we have sufficiently scared all our viewers and each other with regards to our dental health, what tips are there to actually prevent oral infection in the first place? Because we've already talked about, okay, nagulat yung mga patients na, oh, may cavity na pala sila, or they're already showing early signs of infection. How can you actually prevent infection in the first place?
Okay. So, safer, let's start with proper oral hygiene. No? Let's brush regularly, do the flossing. No? And then we don't recommend it just 3 times a day. Every after meal, if you can do so, no?
Kung
Let's
ilang
brush.
meals mo.
Yeah, as often as you can, it's okay. No? And then visit our dentist regularly. Para we can check everything if it's still good. No?
Yeah.
So that's about it. No, the proper maintenance of our oral health is good.
We're going to start brushing our teeth 5 times a day
Yeah.
now. Pero we're showing a bit of tips here on how to avoid oral infections. For some people, probably raising an eyebrow, getting vaccinated against HPV. That's also one of the ways to avoid oral infections. But then, of course, right now, Doc Brent, when you talk about the prevention, some people feel siguro a bit immune to that. You mentioned a while ago na some people don't even realize that they already have infection. For the parents out there naman who want to take care of their kids' oral health and also prevent infections, syempre they're the ones who feel more immune to sweets, or especially with their milk teeth. How would you prevent oral infection for children naman?
Okay. So here it is. Basically, at the age of 6 months, the first tooth would erupt.
Yeah.
And then we would suggest parents to go to the dentist at 2 years of age for the children.
Okay.
Because basically, doon na tumubo lahat ng baby tooth natin. Okay? So that's why when we would suggest to do fluoride treatment, like fluoride varnish for patients, for children who cannot speak, who cannot spit. Okay? And then for older patients, yung mga medyo middle-aged na children, okay, we can put fluoride na ibang type of fluoride naman. Okay? And then for adults, may ibang type of fluoride naman tayo. Okay? And then at the age of 6, tumutubo na yung mga permanent tooth natin. That's why at the early on, dapat yung bata tinuturuan ng mag-toothbrush because we need to improve the dexterity of the hand. Okay? Pilitin or hilain yung bata papuntang CR. That's how you do it.
Yeah.
Diba? You need to train the children.
If you listen right now, just very, very well, you can hear the screams of children saying, stop, please. But they heard it on TV right now.
Actually, that was how I was trained
Really?
at home. Yes.
Okay.
Oh, wow.
Yes. Or you could actually have a deal with the children. Okay, you brush your tooth, I will let you watch this cartoon.
So gawin mo siyang reward.
Yes.
Yeah.
That way, may respect within the children and then the parent.
Yeah. Oh, and normally kids have really good tasting toothpastes, actually. They do, they're flavored versus the adults ones.
Yeah.
So speaking of toothpaste, I have a 2-part question for you guys. So it's very overwhelming when you go to the drugstore, right? There's so many different kinds of toothpaste.
Yes.
So 1, how should we pick our toothpaste and what's the best to keep up our oral hygiene? And 2, in terms of toothbrush, do we stay with the mechanical or do we do the automated one? So what do you guys recommend in terms for everyday use?
Well, basically, any brand would do as long as it has fluoride in it.
Yeah.
Okay, so fluoride is the magic
that
word.
one. And for the brushes, no, it should be soft or super soft bristles only.
Really?
Okay. Yes.
Okay.
Because medium or hard bristles could basically abrade or magagasgasan yung ngipin or eventually damage the gums, which could result in receding of the gums.
Yeah.
So, kung napapansin niyo yung ibang gums, di ba, parang umiimpis siya or umuurong siya dahil doon.
Doc Arviel, are there any myths that we need to debunk with regards to oral health? Because like for example, I didn't know about the harder bristles actually being more harmful in the long run.
Yeah, like that, no? That's the common myth natin, no? The harder you brush, the cleaner your teeth is. No? So, it's not true. No? So, it's more damaging than it's helpful sa ating oral cavity. And another thing, no, if you're a sweet eater, no, if you have a sweet tooth, mas prone tayo sa caries, but it's not that thing naman, no. So it's really the bacteria that feeds sa sugar natin that might cause the caries or cavities. So if you're a sweet eater, no, you have sweet tooth, but you have good oral hygiene, it doesn't matter naman. It's okay. No, so you won't have.
I'm marked
okay
safe.
lang yan.
You're marked safe as long as.
As
pero
long as you have
brush
good
your teeth
oral
5 times a day, ah.
Yeah.
From 3 to 5. Okay, noted.
Yeah, but then of course for the oral healthcare, is there any step that you've seen from your patients, siguro that they do not do enough with regard to taking care of their oral health? You mentioned flossing a while ago. I know a lot of dentists actually do say that not enough people floss. Are there any steps in particular that you feel that people should take more with regard to taking care of their long-term oral health, Dr. Tolentino?
So, yeah, with flossing po, no, with proper technique, no, it shouldn't damage the gums. Dapat dahan-dahan lang, no. Sinasabi nila, if your gums is bleeding, no, it's okay, but it's not, no. If your gums is bleeding, that might be a symptom that there's a problem already, no. Sinasabi nila, if you're flossing, dumudugo kasi ang gums ko if I'm flossing.
And they feel like they're doing a good job, or
So I don't want to do it anymore, no. But it's the other way. If your gums is bleeding, if you're flossing, that means na medyo madumi na ang ating gum, and that needs prophylaxis na or cleaning from your dentist na, or you need na mas tutukan pa the brushing and the flossing.
Yeah.
You need to reach those areas, the hard to reach areas na until the gums, up to the gums, nalilinis natin.
Okay.
Yeah.
Doc Brent, I'll have you say our final words here for those who haven't seen their dentist and should. What message do you have to them, and how can they reach you guys in particular so they can avail of your services?
Okay. Kindly always go to your dentist every 6 months. No?
6 months.
Yes, because these oral infections could lead to infections not only in the mouth but could also spread into the body, diba? You can visit us at Dentcast in Cavite. Okay.
All right. Perfect. Thank you so much for joining us.
Docs. We appreciate it.
We're literally brushing our teeth right after the show.
Yep.
This feels like a meal.
And I gotta make an appointment with my dentist.
Yeah,
too.
apparently,
yes,
diba? We do.
Every 6 months.
Apparently,
And
okay.
all of y'all know what you guys are getting from me for Christmas now.
What?
So, toothbrush.
Kanko water floss.
Ay, mahal ka.
Okay.
That you can get me that.
Thank you so much, Doc Arviel Tolentino and Doc Brent Silangan. Thank you very much for joining us. Again, you can catch them in Cavite. Make sure you look them up and check out their clinic. And of course, get that smile going.
Yes.